Catchlight friends, we have someone really special today. I do want to mention that if anyone has had infant loss or has those types of big feelings, we will be talking a lot about infant loss and bereavement in regards to that. So if you need to skip this podcast to save your mental health, please do. So we're gonna move forward. Today I am talking to Cassandra. She is the founder of Supporting Empty Arms, which we are going to dive down and talk about everything with her organization. But first, Cassandra, what are you drinking today?
I love the peach Palmer tea. That is what I have when I come.
That's your go-to?
That's my go-to. I love it.
It is good. It is refreshing.
Yeah.
So even if so we're filming on the Friday where it's 80 degrees, but Monday it was snowing in March. So even if it was snowing?
No, I probably would just have a latte with oat milk as my other my warm go-to.
I know. I'm doing just a small cold brew with a pump of sugar-free vanilla and some oat milk. I just needed something to get me through the afternoon. You know, it's Friday before spring break, so
right.
I'm just trying to make it through. Okay, so let's talk to me more about Supporting Empty Arms. What is it? How did it come to be?
Yeah.
All those things.
So Supporting Empty Arms is a 501c3 nonprofit built out of what I was seeing in clinical practice and in my personal life. So I was working in outpatient behavioral health and SSM and had my own personal journey, and then decided to start a perinatal loss treatment program, a pilot program with one doctor's office. And we did that for a year, literally 12 months. And in that year, we had over 200 referrals from one doctor's office. And I think about 45 to 50 people actually participated in the program, which says a lot. And the problem that I saw, the main problem was that insurance was dictating a lot of who could come. And that was a big problem to me, because if somebody's struggling in this space, they don't need to hear on top of it, oh, you can't get help because your insurance doesn't cover enough or whatever that may be. So I decided to take it out on my own, and Supporting Empty Arms really started out of that need to give that specialized care to families who've experienced not just perinatal loss, but also birth trauma, high-risk pregnancies, things like that no matter if they can afford it or not, is really the idea.
Wow. So you essentially, your organization raises funds and then helps people pay for that, or it's all? So because do you have more therapists on hand, or is it just you?
At the moment it's just me, but this year we will be growing.
Yay.
So we have a lot going on right now.
Okay.
It is just me at the moment. We do take insurance. We are paneled with Medicaid, which is huge. So we can take Medicaid clients. And we do sliding scale, we do private pay, but sliding scale means even if somebody's copay is too high, which is what I was seeing when I was working at the hospital system, was that somebody who their copay might be, paying their deductible first. And so it's like, oh, you have to pay $100 and so many a session. That's too much to pay once a week. So it's, I talk to them and be like, okay, what can you afford? What is something we can do to make this so that you can get the support that you actually need? So we do take insurance, but we also do sliding scale, and we do have some grant funds. So share support, pregnancy and infant loss support out of St. Charles. So we partner with one of the chapters of Share support, or pregnancy and infant loss support, and they did a fundraiser last year and donated some funds to Supporting Empty Arms, and that money now goes to pay the copay of 3 sessions for somebody who just had a loss, which is really just nice that they don't have to worry about paying anything out of pocket the first 3 sessions, and so we have that going, and then we also just did we do our own fundraisers, every once in a while that will also cover that. So I was looking it up, I think about 25 to 30% of our sessions are reduced rate or free that we've done in the last year.
And is that all referred by doctors? Or what if someone, because I feel like sometimes trauma comes up years later, right? So what if someone, maybe it was 3 years ago, maybe it was 6 months ago, can they reach out to you as well?
Absolutely, yes. So it's not just recent. So we will see anyone who's experienced these types of traumas, whether it was 2 weeks ago or 10 years ago, because especially if it's a deep-seated trauma that is still impacting their life and they just haven't had a chance to process it yet, we absolutely want to be able to help them with that. So I do have clients that their losses might have been 7-9 years ago. I had somebody reach out who her loss was 20 years ago, but it was very impactful in her life.
Are you comfortable sharing your story and how supporting Empty Arms came to be?
Yeah, so my clients all know that I've had a perinatal loss, mostly because when I was experiencing it and I needed to find a therapist, that was a big deal to me. I was like, I don't want to see somebody who hasn't experienced this because they probably don't have a clue what I'm talking about, because it is very special. There are some emotions that you go through that you have no idea what to expect or have any idea what it is until you've experienced it yourself. So we got pregnant with our daughter, and she was 20 weeks gestation when she was stillborn. And from that experience, I am a therapist. I went back to work 2 weeks later, about a week later actually, and worked with a bunch of therapists. Not a single one knew how to talk to me, which to me said a lot. And I was just flabbergasted as to why do my colleagues who've been in this field for years not have a clue how to talk to me. And so I did a deep dive in research of why that is. A big piece of it is we don't study maternal mental health, meaning postpartum, perinatal, any of that, in grad school. Why?
I'm not surprised. I keep getting disappointed in some aspects of women's health, and I'm not surprised, but I'm always disappointed.
Always. Yeah, because we are so far behind with women's health in general. So of course women's mental health is also going to be on the back burner as well. So we don't teach literally any of it in grad school. So the only people who are specialized or actually say that they specialize in maternal mental health are those who've gone out and done their own training to learn how to work with this population. So that's a big piece of it, is that we don't teach it. And then another part was that as a society, we don't talk about perinatal loss or birth trauma or high-risk pregnancies or any of those things. Or pregnancies.
Yeah.
Because it's, or in the not excited sense.
Sure.
Right? Usually it's like, aren't you so excited? I'm going to tell you right now, not every mom is.
Well, I think you can be excited and still have other emotions like being scared, or there's just, you don't know it till you're in it.
Exactly.
Someone can tell you like, oh man, like there's going to be lots of changes, but you don't realize it till you're in it. Absolutely. Yeah, and I would think as a woman who's had 2 children myself, and a high-risk pregnancy, and a traumatic birth, no offense to my male friends, but I think I would want to talk to a woman. Yeah. You know what I mean? Absolutely. Not because men can't have empathy or anything like that, but it is such a shared and unique journey to women that I feel like personally I would want to share and open up to someone who's, had unfortunately similar experiences. Absolutely. Yeah. Because unless you've experienced it, you just don't know what it is. And I can say for myself, before I had my daughter, I had no idea that after that along comes being jealous
of pregnant people, being angry when I saw people who had children, or like, because those weren't natural emotions to me.
Sure.
And so it's not just you lose your child, you also lose a sense of self. You lose part of who you usually are. And so like those types of things are very just intricate and different to that type of grief versus others. There's also the idea that, in society, as a collective, when we grieve, when you lose a father, a friend, a grandfather, you talk to your family and friends about that person as a way to grieve and a way to process the loss. When somebody loses a baby, especially if it's in pregnancy, nobody else has that shared connection. So it is extremely isolating. So then the mom and the dad too, dads also grieve, they don't know who to talk to. For one, because it's really sad, because they don't know who can hold that story for them without having, not helpful comments, or that the other people don't know what to say, which is fair. We don't talk about it enough in our culture that people don't know what to say. And so it is a really difficult conversation.
It gets glossed over with
Absolutely.
like, oh, you could try again, or, so many other comments. What was something that you needed in your moment of grief when you were processing your daughter's loss? Does she have a name?
Yes, Milena, thank you.
Milena?
Milena.
I love that name.
Oh,
That's
thank you.
beautiful. So when you were processing Milena's loss, what did you need that now you strive to help other moms, parents?
Oh, for one, that. People acknowledging that she had a name. So thank you for that.
I learned
Honestly.
that from you. I did.
Yeah. I mean, it's such an important thing that we don't take, that we take for granted. We take that, idea of this was a human.
Sure.
She had a personality. She, all the things.
She was loved.
She was very much loved.
Yeah.
She was very much excited for all of the stuff. So that idea of giving other people that opportunity. And so if I have somebody who's had a loss, I always ask, did you have an opportunity to name your baby, or did you want to? I've had clients who didn't feel like it was called to them to name their baby until years later, and then now has named their babies, because the one I'm thinking of in particular, she's had 4. And so she's now named them all, and how therapeutic that was for her. And that's not for everybody. That's not everybody's journey, and that's okay. It's for one, giving people a space to grieve in the way that they personally need to grieve, because it does look different for everyone. Not everyone wants to name their baby. Not everyone wants to do something in memorial of their baby, and that's all okay. And I felt like I needed to be able to talk about her and have someone hold me in that space without judgment, without trying to fix me, without trying to, tell me what I should do it differently, and I had a really hard time finding that, even within my own therapist, because I obviously went to therapy afterwards. As a therapist, I feel like good therapists should have a therapist, because we all have our own work to do. And I had a hard time with that as well, as finding a therapist who could hold me without saying, well, what about adoption? Well, that's not everyone's journey.
Right.
So it's, instead of giving judgment or giving, it's just holding space. Mm-hmm. So I definitely try to do that for people. And then also teaching others. That's a huge piece of what I do with, giving resources and giving information to other people, is I want to educate others to also be able to hold space in a proper way. So I've had many friends and family members come to me and say, hey, I just had a loved one lose a baby. What do I do? What do I say? I am all for that. I'm here for you to tell you, be okay, this is what you can do to be helpful, Mm-hmm. And I think that's the most important thing we can do.
So this is airing in May, which is Mother's Day, which can be an amazing holiday, but can also bring up big emotions, right? Because I'm sure there's a lot of moms who have had either losses and children, or traumatic births and children, and so it kind of just brings some big feelings up, but I really wanted to touch with you because shamefully what I didn't know is the weekend before Mother's Day is National
Bereaved Mother's Day.
Bereaved Mother's
the
Day.
first Sunday of May is Bereaved Mother's Day. So it is, I didn't know about it either until I started doing this work. And then I found that out. And again, some mothers want to celebrate it, some others don't. But it's an opportunity to honor the moms who are moms, you know, but they don't have children walking this earth. So, but yeah, Mother's Day in general, like the normal, typical Mother's Day can be a beautiful holiday, but it can also be a really touchy one for moms. And I just actually had a client recently tell me about how challenging it is when you first find out you're pregnant. People are like, oh my gosh, congratulations, you're having a baby, the baby's coming, all these things. But as soon as you lose it, it's like, oh, you lost a pregnancy. And then when you become a mom, it's not, so you've lost, for some reason, there's a loss there.
And there's a disconnect.
Yeah.
Disconnect in language and yeah.
Yes. So these women who felt like they were already moms are now, oh, when you become a mom, then you can celebrate this holiday. And that is so, so, so difficult when they, in their heart, do feel it. And so that's a challenging piece.
I never have stopped to think about it like that. In terms of like how when you're pregnant, it is made that way. And then if you lose a baby, then it's like, oh, a pregnancy. Not a baby, a pregnancy.
Yeah. Even clinically, they change the terminology. You know, it's the products of conception or pregnancy. They don't say baby anymore. And so it even clinically, it's the wording, it's changed.
Do you think, I don't know clinically, but do you think it's because it makes the person who hasn't lost the baby more comfortable?
Oh, probably.
Do you know what I mean?
Oh, yeah.
Yeah.
We think about, I was told when I was first talking to my colleagues about starting the program that I did, I said, well, why hasn't anyone done this before? And I had a colleague who's a therapist, was like, well, because it's too sad. It's like, imagine the people who are going
so
through
close.
it.
You were so close there. Like, yes, that's why we need you, right? Mm-hmm. Oh my goodness.
So I did want to stop for a second because I wanted to bring up for why I started the nonprofit was because of what I was seeing in clinical practice, but also we don't talk about it enough, but 1 in 4 pregnancies end in loss. Mm-hmm. And 1 in 5 women, birthing people, experience perinatal mood and anxiety disorders within pregnancy and within the first year postpartum.
Yeah.
And because we don't teach it in school, there's very few people who actually are trained in these types of traumas. Mm-hmm. Or if they are, they're private pay only. They take limited insurance, or they're limited. So
when you say, what you just said, moods, what'd you just say?
Perinatal mood and anxiety disorders.
So would that be like postpartum depression or postpartum anxiety?
Yes.
So that's what you're talking about when you say that. Okay,
Yeah.
I just wanted to make that clear.
Absolutely, yes. Mm-hmm.
I needed to, as layman's terms.
Yeah.
But yeah, you are so right. And it's almost like she just has the baby blues.
Exactly.
Like,
I've had providers still say that to me when looking clinically and thinking, absolutely not. She's not having the baby blues.
Oh my gosh. Yeah. Of course I am. My hormone just tanked in a matter of hours. It is amazing what a woman goes through. And then it's just like, oh, here you go.
Yeah.
Here's your baby.
Or breastfeeding.
Yeah.
The hormones and the shifts that change with breastfeeding. Mm-hmm. And we do not talk enough about that.
No.
People are like, oh, I lost all this weight.
I gained weight when I was breastfeeding.
Same.
Not funny, but it's normal. I think, so how do we change that? How are we changing this?
Talking.
Talking.
Yeah, having those opportunities. I really want to highlight what we did in October.
Yeah.
Because you and I did here at PJ's, we did the Pregnancy and Infant Loss Remembrance Day event. And I want to thank you from the bottom of my heart for allowing that to happen, because by saying, yeah, let's do this, let's open this space for these grieving families, you allowed the community to know that this is a safe place. And that's how we do this. That's how we change this, is by having those opportunities for the community to say, oh, let's talk about this. We did the Pay It Forward board that was so successful.
It was so successful. We had drinks for days. But that just shows you what a need there is. Truly. I mean, we had, I was not here for that particular day, the whole day, but someone did come up to my baristas, because we trained my baristas. This is what you're going to do. They might put their baby's name on this cup because they want to hear their baby's name.
Yes.
And we had little wings. And so my baristas are phenomenal, but they're also young, right? And so me and you, wanted to make sure that they were properly, I want to say educated, but held space.
Yes.
In a very respectful way, right? Because we do have a lot of fun here, and we do. They're always joking around with customers and stuff, so we needed to kind of pivot that just a little bit, But I think it worked out really well, and that's something I foresee us doing every year, because there is a need for it, and that is how you change the conversation.
Yeah, absolutely. Having everybody on the same page of what is acceptable, and that this is important to have. We had somebody write a note and leave it here on the table for others to read, which I thought was just so beautiful. And it was just that I've been in this space, I'm, caring for you. And it was just really just a beautiful, moment, I think, for the community to know. And I think going forward, people will know that this is an okay place. We're able to do that here, and people can hear that. And then also, we're talking to providers as well. So I am, building a lot of connections with other providers, and not just OBGYNs, but also doulas and lactation specialists and midwives, and because to be able to share together, we can't all do all of it. So we have to work together. And so by having those conversations and sharing the same language, that's how these conversations change. And letting it be known, it's like your feelings are valid and normal. I was very fortunate to have, I'm really close with my mom and my sister, and so obviously my sister had a baby first before I did, and then my mother-in-law is fantastic, and so I had these amazing women in my life who were like they kind of gave me the down and dirty of it, this is it's okay, ask for help. I remember it was the second night we brought my daughter home, and none of us slept, and it was so early in the morning. And I basically sent out a SOS. I'm like, we need help. We can't do this. But I knew I was had been warned that that was, and it was my second pregnancy, but that second day is about that time where it hits you. Your adrenaline's no longer there anymore. Your hormones are tanked. Your milk's coming in. There's so many things going on. And I remember my mother-in-law was like, I'll be there. I'm coming. It was, I feel like it was probably 3:30 in the morning. Just a godsend, And so just having those women, but then I know I'm very fortunate because a lot of people don't have that village. Yeah.
So that's another thing that I would like with the, communicating and holding these spaces. I'm hoping that we can create that village as well.
Yes.
Because it's just, oh my gosh, it's so hard.
Absolutely.
And God bless the dads too. My husband, he was amazing in every sense, but they don't know. They have no idea what you're going through.
Yeah.
You know what I mean? And then you're kind of, I was not the nicest because I was tired and
You're the milk factory.
yeah, you know?
Yeah.
So it's just nice to have those women in your life. So whether it's a mom, sister, a friend, someone you meet at PJ's or someone you meet from Supporting Empty Arms, like I understand how vital it is.
So we just did the Missouri Maternal Fetal Health Convening. It's amazing.
What is it?
So 2 weeks ago, Supporting Empty Arms was invited to do a resource table at the Maternal and Infant Health Convening it was in Chesterfield, but it's basically Uplift Connection and the PQC are organizations that kind of work on maternal wellness and basically like just the maternal and fetal mortality rates in Missouri are much higher than they need to be.
Yeah.
So it's these organizations that come together and they create this incredible conference that had 400 people attend, and it was all doulas, lactation specialists, therapists, OBGYNs, people in this space. And so it's 2 days of training and just educating people on everything. So we were there with a resource table, giving out our information to providers around the state. And then we also got to speak. So it was crazy. It was my first public speaking like that. But I did it collaboratively with a dear friend Dr. Kairova, who is a perinatal psychiatrist out of SSM, and Rachel Villarreal, who is a nurse practitioner out of the MFM satellite office in SSM. So the three of us kind of put together this presentation on the power of collaboration, on why that is so important to patient care and to the mortality rate. Mm-hmm. Because when providers stay connected and communicate, we can make sure that everybody gets the support that they need.
Yeah.
So it was such an amazing presentation. It was very well received, and we did it interactively. So we did 2 case studies, and we asked people like, okay, well, if this were to happen, who could help in this situation? And people would raise their hand and be like, okay, look around the room. Who are your lactation consultants? Who are your OBGYNs? So we can all start to connect.
Really cool.
Yes. And so I also had a sign-up sheet at our table of who would like to collaborate with us, and about 40 people signed up. So it's the idea of not just handing someone a list of therapists, so which is what happens right now when you lose a baby or you've had a traumatic birth, or actually not even when that happens. Usually your doctor's like, oh, here's a list of therapists that you can call and good luck, right? First of all, those people do not have capacity to make a phone call. They're not picking up the phone. They're barely picking up their shoes.
Surviving.
Yeah.
Right.
They're not doing it. So the first key is the closed loop referral of the provider saying, do you mind if I give your information to a therapist that specializes in this? Would it be easier for someone to call you for therapy? Mm-hmm. And I've asked that question myself to many patients, and the answer is always yes. Yes, please have them call me. I'm not going to make that phone call.
Yeah.
And that's okay. We need to meet them where they're at. Mm-hmm. And so by me connecting with the providers and saying like, here, this is a way that you can send the clients to me directly, so that it's one less step for them to have to do. And then I contact the client, we get connected, and we make an appointment. But then if we do a closed loop referral, which we're on Unite Us, which is a national platform where major hospital systems or organizations can connect with nonprofits. Typically it's for social determinants of health needs like food insecurity, housing needs, things like that, but they also have behavioral health. So we're on there as a nonprofit, and so SSM, BJC, Mercy, and other providers can refer patients to me through Unite Us, and then I can communicate back to them, which is critical. Mm-hmm. Especially, like I said earlier, when I have a patient that has a medical need, I can then write to them, which has happened to me in the past. I've had somebody say, hey, I'm still bleeding 3 months after I delivered my baby. And I'm not an OBGYN, but I'm pretty sure that that's not normal.
Right.
So, and I had asked, like, hey, have you talked to your doctor? She's like, well, I tried calling, but I couldn't get through past the nurse's line. How often do you think that happens?
So many times.
So many times. So because of the closed loop referral, I was able to reach out to the doctor directly and, with the patient's consent, obviously, and, messaged the doctor, and the doctor made an appointment, and thank goodness, because she could have had infection, she could have had all kinds of stuff if that didn't happen. And so that is one of the things that we talked about in the presentation that we did, was just why that's important. So it's not, yes, sometimes patients will tell somebody something in one room and tell somebody something else in another room, but it's also, what if they can't get through?
Right.
And they need somebody else to help advocate for them. Mm-hmm. So that's a huge piece of community is right now, Supporting Empty Arms community is fairly small, but that's intentional. I'm trying to build the network with the providers so that when the clients come in, they have a network. It's not just me. Mm-hmm. I can say, okay, if you want your next birth to be a home birth, I have the name of a midwife who does hypnobirthing, or I have lactation, I have bereavement lactation, I have, my friend who's a psychiatrist who does perinatal, issues. Like, having that network is so critical to people's care because they don't have capacity to do it all themselves, and we can't expect them to.
Right. Yeah, they also don't have the capacity or sometimes even the time when they go back to their 6-week checkup.
Exactly.
To lay it out on the table, right? Like, it's good to have that community.
Yeah.
Mm-hmm, for sure. So you kind of segued. Where do you see Supporting Empty Arms going? Like,
great question.
Yeah. Yeah.
So we're starting with growing in Missouri.
Okay.
And we are completely virtual, so we can cater to anyone in the state, including rural communities. And my goal is within the next year to expand into a few other states.
Okay.
My major goal is to be nationwide. Because we have the access through Unite Us with all major hospital systems, that's my hope is where we're going to get most of our referrals. Mm-hmm. And so that can be nationwide. And so we'll be able to have therapists in all these other states and who can talk to clients wherever they're at.
Yeah.
Yeah.
It's big goals. That's amazing though. It'll happen. I know it'll happen. For listeners who feel connected to this, how can they get involved? How can they support you and your mission? What are some ways?
Yeah, so right now on our website we do have a link to our Zephy page, which is where we take donations. We are looking at doing a fundraiser in the next few months, but I don't have the information quite yet.
It's okay.
And we'll probably do another one in October like we did last year. Mm-hmm. Not quite sure what it will look like yet. Because again, it's just me right now. But as we grow, we'll have more support. If anybody wants to help me do fundraisers, please reach out. I'm all for it.
Right? They're good at it?
Yeah. Mm-hmm. Yeah. So that's kind of where we're at right this second. Also, I have people who like to do things. They're action-based. So I've had moms make mini baby blankets for stillborns, and they take them to the hospital, and that way the babies can be wrapped in something that's handmade, and then the families can have it to take home. I've also had families crochet or sew hearts to give to moms who've had miscarriages because they don't get anything tangible, and so those can be donated to the hospitals, so people can do those types of things too.
I was just going to ask about upcoming events. So you touched on that already. So we're going to announce those later?
Yes.
Okay. Well, share them with us.
I will.
And obviously we'll have flyers or whatever at PJ's, but Couchside Coffee Socials will also push those out for you.
Thank you.
In my head, I'm thinking like maybe we should do like a little walk fundraiser with it's October 15th. is the day for
The Remembrance
yeah.
Day.
I wonder if we could do something like that. I think that would be needed.
Yeah.
Yeah, we'll have to think on that some more.
Yeah.
Man, we talked a lot about community and how it's important. And the more I do this podcast, the more I realize, like, community is everything in every aspect of someone's life. Whether it's owning a business, being a parent, mourning losses, just the way we need to show up for each other.
Yeah.
So if there was some words of wisdom or encouragement, what would you tell someone who had a friend or a family member who is dealing or has dealt with this loss? Because I think that those words and that language really matter, like we previously touched on, but what's one way they can show up, and what are some words that they can say that still hold space?
Yeah, absolutely. So first, you kind of mentioned, or we didn't touch on it a whole lot, but like what not to say.
Yes.
I think that it's important to kind of point out if the thought comes in of what, or like, at least, there you go. Okay. If if the words "at least" come to your mind, do not finish the sentence, because those are typically just not going to be helpful comments, which for some reason in our society we feel like it is, and I don't know why, but it's just for perinatal losses, because you would never say to somebody who lost a sibling, "Oh, at least you still have a sister." You'd never say that, but you can say, "At least you have other children," to somebody who's lost a baby.
Yeah.
So if the words "at least" come in, at least you can get pregnant, at least any of those, they're not helpful. Also, a lot of times people say things because they feel like it's helpful, because they want to fix it, and because it's hard to be in this space. It is painful, it's dark, and so a lot of people just want to fix really fast, which is, like, what about adoption, or, have you thought about this, or don't worry, you'll get pregnant again. Like, all of those things, they're not helpful, because we don't know what their journey is, we don't know what their story is, and so it actually can cause a lot more harm than good. So what people can say is, even if it's, "I don't know what to say right now.
Yeah.
Can I sit with you?" If it's a really close friend or family member, "Can I do your dishes? Can I do your laundry? Can I go pick up groceries for you?" Instead of also, if you're saying like, "Well, what can I do for you?" They don't know.
Right.
They're surviving.
Yeah.
They're trying to keep their head above water right now. And so it's really hard to be able to delegate and say, "Oh, you can do these things for me." But if you say, "Hey, can I get this for you?" they're much more likely to say yes. So being open in that way, and just holding space in the way of just saying, "Can I sit with you?" Even if we don't talk, even if we just are sitting quietly, cry together, whatever we need to do. But also, know that some people don't have capacity to hear the whole story, which is fine. Kind of being able to say that to somebody, because somebody who's especially if they have a loss or a traumatic birth, they don't know who has capacity to hear their story, because they think it's too dark, it's too sad. They don't know, they won't be able to handle it. So if you feel like you can handle it, let them know that. "Hey, I can handle it. If you want to be able to share your story with me, I can be here for you for that."
Hold that space. Yeah. Man. Okay, so I'm trying to think, is there anything else you want to add to this conversation? Did I miss anything?
Gosh, I don't think so. I think, just you giving this space is huge. And by allowing it to be here in the coffee shop is huge for the community, so that people know that this is a safe space. So I thank you for that. I thank you for having me. yeah, I just want people to be able to start having those conversations more openly and know that it's okay if people are saying that they're sad after they've had a baby. Let's talk about it.
Right. Yeah. Understand. What do you need? Right?
Yeah.
Awesome. Well, thank you for being here. I am looking forward to seeing Supporting Empty Arms grow. As hard of a topic as it is, it's very much needed. Any mom knows that. Any dad knows that. So I applaud you for seeing a need and taking charge.
Thank you.
Of course.